The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone. We are waiting for a few more people to log in, so if you'll just be patient, our webinar will begin in just a few moments. Good evening, everyone. Thank you for joining our Parent Programs webinar on Your Guide to Student Health Services. I'm Penny Wyatt, and I'm the Director of Orientation and Parent Programs. And I want to just give a brief introduction and explain how the webinar will run. Before we begin, I want to just explain that this is the volume level for the webinar. If you can adjust the volume on your end with the controls on your computer. And we found in the past that it works best to hold all your questions until we've reached the end of the presentation, because for the most part we find that the presentation will eventually get to your questions. So we'll alert you when we're getting towards that point in the webinar to let you type in your questions. If there is a question that we need to research, we'll email the answer to everyone following the webinar so that everybody can get that information. We'll also state your question so that everyone hears it and then proceed into the answer. I would ask that you allow 5 business days for us to post the webinar slides and audio recording on our website, but you will be able to find that at parents.tulane.edu. You'll navigate to the Webinars tab that you'll see on the blue bar that is a horizontal blue bar across the screen. And you'll find this webinar and previous webinars archived there. So I do want to just ask once if you'll use the raise your hand feature just to let us know if you're logged in and ready to go. Okay, I'm going to ask one more time if you can hear, if the audio seems to be coming through correctly, if you'll raise your hands. Okay, well, I will now turn things over to my colleagues from the Student Health Services, from Deanie Stoulig, who is the nurse manager, and Maeghan Livaccari, who is the associate director of theWell, our comprehensive wellness center. So they will begin. Thank you so much.
We're sharing a space here, Maeghan and I, so you'll hear my voice and then sometimes you'll hear Maeghan's voice. So we'll just go through the presentation and then be available to answer any questions at the end of the program. I just want to go over what we offer as far as services. It is an ambulatory care center, our student health services. We have clinics both uptown and downtown, and we've grown so much recently that in the last 2 years we've had to separate our uptown services into 3 different locations. So the Well, or the Wellness Center, where there are tons of programs to engage your student and tell them what they need to know to take care of themselves, is located under the Wiley Center, which is the Student Recreation Center, right in the breezeway there to the right of the steps. If you were on campus, hopefully you got to see the well. On the corner of Willow and Newcomb Place is the Student Health Center, which contains the pharmacy and the lab and our primary care services and our women's health services and men's health. And our CAPS, or counseling and psychological services, has moved to the upper campus. So these are the things that we'll talk about today, now that I've kind of given you a geographical description of where we are and how we're divided. We're going to let you know what services are offered, what to do when your student is ill. We'll discuss some health information privacy issues. We'll talk a little bit, or a lot of it, about student health fees, the student health center fees, and insurance. And then we'll have room and time for questions and contact information. So this is essentially what our divisions look like. We have an uptown and a downtown medical center, student health center. The downtown center mostly services our med students and our School of Public Health and Tropical Medicine. But with our undergraduates now taking courses in public health, sometimes they can find themselves on the downtown campus, and we do have full services available at that location. We are at the Uptown Student Health Center, And the Well is also uptown, and so is PAPS. We do realize that one of the biggest concerns, or your number one concern as you send your student to us at Tulane, is their health and well-being and their academic success. Our role, as we see it, all of our staff try to focus on helping to develop a new relationship between parents and their young adults, that students confer with parents. We help empower your students to take more responsibility for their own health and wellness. And we encourage a successful transition for both the parent and the student. And I know it's a transition for all of us. All right, these are the services that we offer in the uptown clinics. You can see that all of those listed there are pretty much offered uptown, but some in different buildings. So we do have primary care, women's health, men's health. We have a nutritionist. Our mental health services are now located in a separate building. We offer allergy clinic, meaning if your student is on allergy injections from an allergist or their ENT physician, you can send those with them, and we can give, according to your students' physicians' protocols and our protocols, we can give them their allergy shots, whether that's weekly, every 2 weeks, monthly, twice a week, whatever. We also offer travel clinic, extensive travel clinic. It's amazing where students that go to Tulane travel and what internships and things that they do abroad. We also are very unique in the fact that we have a student-run emergency medical service. We call them TEMS. It's Tulane Emergency Medical Services. We own 2 ambulances, and our medical director of the Student Health Center is the director of this student-run organization, and they are on call 24/7 throughout the fall and spring semesters. Of course, they take the same breaks that your students take during spring break and fall break and winter break, but during the semester when class is in session, they are available. The Uptown Primary Care Clinic is staffed by 5 physicians, nurse practitioners, and registered nurses with experience in college health. Some of our physicians are pediatricians with adolescent medicine training. Some are internists, some are family practice. And we have a system where we refer students for other specialties. We do not have x-ray capability in our building, but we generally can handle just about any common health problem that an 18 to 25-year-old would walk in with. We also have nurse triage, where the student can call and manage their illness, sometimes just over the phone, depending on what's going on. So in primary care, we regularly offer management of chronic and acute illnesses. We do have an appointment clinic with the majority of students receiving a same-day appointment. And then we have a nurse that works all day answering phone calls from your students, trying to reach physicians that we refer out to. And let me just remind you that these full-time physicians work only with us. They do not have jobs in other places. They are employed by Tulane. I mean, some of them may moonlight on weekends in emergency rooms, but that's good for us and for your students. So we do have nurses that can be reached via the phone. And for instance, there are some things, some symptoms that your student's not going to get an appointment for. If he says, I have cold symptoms or congestion or sore throat, we will ask them to sign in and see a nurse. One of the walk-in nurses will examine your student. If he needs a throat culture and just significant over-the-counter medicines, we can recommend those. We can refer them to the lab for throat cultures and various things. But if your student walks in and they've got 102.4 fever and their throat looks horrible, we're going to figure out a way for them to see a physician. So it doesn't mean they can't have an appointment. It just means that a nurse has to evaluate them first, for instance, for cough, congestion, sore throat, just so that we know that the physician's appointments are utilized by those students that need more than what the nurse can do. In our primary care services, we offer all immunizations. So if your student's having trouble finding, for instance, his meningitis vaccine, the meningococcal vaccine, we have all vaccines that he could possibly want. Traveling anywhere in international travel, we offer travel prescriptions, travel medicine through our nurse travel clinic. If your student is an asthmatic and his albuterol inhaler is just not doing the trick, he can come in, we'll evaluate him, we can do nebulizer treatments, we do IV hydration, wound care, we put stitches in, we take stitches out. So we do lots of things that are done in any primary care, acute care setting. We also offer acne management. 2 of our physicians are certified to prescribe and order Accutane and do that whole regimen. So the walk-in clinic, as I discussed before, is nurse management of minor issues, and we have standing orders to perform screening and over-the-counter medicines, and of course acute illnesses are directed to a physician and treatment room. For instance, if your student walks in at 9 a.m. and we're booked until 1, but their fever is 103.4, we're going to put them in our treatment room. We're going to try to get that fever down and just monitor them until a physician can see them. Our women's health clinic offers most things that a young female would expect at a college health clinic. So our students get their first and annual exams with PAPs and pelvic exam. We offer contraceptive counseling and several contraceptive options. We do pregnancy testing and a variety of services to meet the needs of our young women. Our men's health clinic is managed by Dr. Jim Farrow, our medical director. He has men's clinic addressing the treatment, evaluation, and counseling for a variety of men's health issues 3 days a week. So generally a student can be seen that week if they have issues. He does a lot of teaching and a lot of counseling. Again, our Tulane emergency medical services are available to all students. They are a dedicated group of volunteer students. Most of them are majoring in pre-med. They want to be physicians. And we can, for instance, if your student walks in at 10 a.m. the second week of class and we think they're having an appendicitis attack, then we would call TEMS to pick up your student at our student health center and transport them to the emergency room of their choice or to the emergency room that has the most availability. Our TEMS students go online and see where the shortest wait is. Generally, they go to Tulane Medical Center, but depending on the wait time, depending on the acuteness of the illness, they could go elsewhere. So they provide a great service to our students, to your students. We also have a pharmacy and a lab and allergy and travel clinics. Our pharmacies, you can transfer prescriptions into our pharmacy. You can have, if your student has a chronic illness and they are managed by a physician at home, that physician can fax in orders for monthly labs or every quarter labs to our lab, and the student would come in and have their labs drawn here, and we can fax the results to your physician at home. The Downtown Student Health Center is located in the Elks Place, which is adjacent to the Saratoga Garage, and I know that's like Greek. You haven't gotten to know this campus yet, much less the downtown campus. Generally, it's for the grad students who are in classes in the downtown School of Public Health and School of Medicine, but our students can be seen at either one. So there's they offer routine GYN care and travel clinic services downtown as well as uptown. Our counseling and psychological services, we affectionately call CAPS. They offer psychiatric services, short-term counseling services, group therapy, crisis services, and outreach services. Most of the short-term services are offered, for instance, 5 to 10 times, and some need less and some need more. And if it's identified that the student needs long-term services, they will be connected with a provider in the community. During our business hours, which are the same as our primary care clinic hours, our student health center hours, which we'll talk about in just a minute, they can walk in if in crisis. So we can refer students in our building over to CAPS. CAPS will call me sometimes and say, I have a student here that needs some medication. My first appointment with a psychiatrist is not till tomorrow. Is there somebody that they can see there? So we work very closely with our CAPS services to get the needs of our students taken care of. I'm going to have Maeghan talk a bit about theWell.
Hello, everyone. The Center for Wellness and Health Promotion, known as theWell, is the public health arm of Student Health Services. Our education and prevention efforts aim to empower students to live healthy lives. Many of our events and programs within the residence halls are provided by our certified peer health educators. Our peer educators gain experience with public health practice, public speaking, and program planning. If your student is interested in health, please ask them to get in contact with us. Services provided by theWell include free anonymous HIV testing, tobacco cessation, alcohol education, safer sex supplies, and sexual health education. Students can come by theWell on Mondays and Thursdays to get a free massage. The first event offered to your first-year student by theWell is Soiree. This is the time students can find out more information about resources on campus and health information. By the end of August, you and your student should receive the first Student Health 101 newsletter. This newsletter keeps you updated on all college health, so be on the lookout for it in your email inboxes. Alcohol is a critical public health issue among college campuses nationwide. Alcohol education and the safety of our students is a priority at Tulane. The online alcohol and sexual assault prevention course is the first opportunity we have to provide students with baseline education. Your student is required to complete and pass the course within 80% by August 19th. There is also a module for parents which provides information and resources as well as the opportunity to look at the course your student is taking. Please have a conversation with your student about your academic, behavioral, and social expectations. Ask your student about their expectations of alcohol and discuss the risks and consequences associated with alcohol misuse and abuse. Stay in close contact with your first-year student, especially during the first 6 weeks of the semester. The first 6 weeks of the semester are very important to academic success. It is also a time period where students may begin to experiment with alcohol and drinking heavily. Your student is trying to adjust to living on their own, trying to fit in and dealing with pressure from their peers. If you recognize your student should speak with someone about their alcohol or marijuana use, please refer them to basics. Brief alcohol screening and intervention for college students is evidence-based, non-judgmental, student-centered, and incorporates motivational interviewing to elicit behavior change. This is an opportunity for your student to explore their alcohol or marijuana use. If your student violates the alcohol policy, has to be medically evaluated for alcohol, or transported to the hospital due to alcohol, they will be mandated to attend basics. There is no cost for voluntary and first-time mandated referrals. The student will be charged $200 if they are mandated for a second time or third. There is also a $75 no-show fee for each appointment missed. The majority of our referrals to basics are mandated and first-year students. My Student Body is a great way to help start the conversation about alcohol use and misuse. Confidentiality is critical to providing consistent care to all students. Students will be asked to sign a consent form before information is released to any party requesting information.
All right, now that we've told you everything you need to know, let's go back to the basics. So what to do when your student is sick. They call you at 3 o'clock in the morning and they have fever. My advice to you would be to tell them to take something for that fever, drink some fluids, and check it again in an hour. If it's down, if the temperature is down, then be on our step waiting for us when we open at 8 o'clock in the morning. If the fever doesn't go down an hour after taking some acetaminophen or Tylenol, that's when you want to call our on-call physician. But we'll get to that in a minute. So acute care is available by appointment and by walk-in all year. These are our fall and spring hours. We expanded hours last year, and on Monday through Thursday, we're there. They can come and see us before that first class even starts if they've been suffering, since 3 o'clock in the morning. When we do frequently have students there on our bench right outside the door at 10 minutes to 8, and I applaud them for doing that. The earlier they come, the better. So we're here Monday through Thursday, 8 a.m. to 6 p.m. On Friday, we close a little early. Friday is 8 a.m. to 4:30 p.m. And we're here most Saturdays and some holidays from 9 to 1, and that is an acute care clinic only. Generally, our primary care clinic runs from 8 to 6 p.m. with at least 4 or 5 providers, and again on Friday from 8 to 4:30 with 4 or 5 providers. Our Saturday clinic is 1 provider and 2 nurses. So it's not the time for a student to walk over and say, my acne has been bothering me for the last 2 months. Let me see what I can do about it. But it is the time when we want to see your student if they did wake up with 102 fever and a horrid sore throat at 3 o'clock in the morning. They need to come as soon as possible. I encourage students, if we see them on a Thursday and they came to us in the beginning of the illness, I always tell them, if you're worse, I want to see you back in here. If you wake up on Friday night at 2 a.m. with fever, I want you on my doorstep at 9 a.m. on Saturday morning. We are closed on Sundays. Most holidays, as I said, we have a 9 to 1 acute care clinic. So I'll just rattle off a few to you. This Labor Day, Monday, we're here 9 to 1. The day before Mardi Gras, we're closed on Mardi Gras, but the day before Mardi Gras, which is a holiday in the city, we're here 9 to 1. Martin Luther King holiday, we're here 9 to 1. So our times, our operating hours are on our website, but generally we're here in fall and spring, most Saturdays and some holidays. So if your student is sick and we're open, he can call the nurse triage line. It's always helpful if they know what their temperature is. I tell this to students all the time. If you call my receptionist and say, I feel feverish, you're going to walk in and have to wait and be evaluated by the nurse. But if you have a thermometer and you know your temperature last night was 102.6, and you say that to my receptionist, she knows to offer an appointment with a physician to you. So send your students with just general medicine for fever and aches and pains like Tylenol and ibuprofen and a thermometer. So if your student is ill and they call at 8:30 in the morning, we can usually get them into a same-day appointment. If they wake up ill, but if they wake up ill, but they're trying to trudge through classes and don't call us till 4:30, we may not have an available same-day appointment, but they still should walk in. If they're sick, we will figure out a way for them to be seen. We do have an emergency on-call physician for acute issues during the fall and the spring semesters. The physician is available via an answering service. That phone number is also on our website. We encourage you to have your student program that number into their phone. And what they'll do is they call the answering service. The answering service will take your student's name and phone number. They will hang up, call the physician on call, who is not here at the health center waiting to see them, who is not going to come to their dorm and do a home visit, but they will give them advice over the phone. So the physician on call will call your student back to help manage his issue. One of the things that we'd like to promote tonight also is helping all of us to understand how very important it is that all students get a flu shot. The flu season last year was kind of tricky. Everybody came back after the winter break, having had horrible flu experiences, and we just couldn't provide enough flu vaccines. Let's avoid that crunch in January and encourage your student to get their shot when we are out there. I have 2 and 3 nurses that go, as we're closing the student health center, we go to the dorm lobby, the residence hall lobby, and offer flu shots from 5:30 to 7 p.m. These are the dates and the dorm that we're going to be in. Now, if your son lives in Sharp and he has a Wednesday night class, he certainly can come to any other of those buildings. You don't have to live in Butler to get your shot on Tuesday, October 1. We just go to the dorm, the residence hall lobbies to make it easier for your student. We also offer flu shot clinics at the Student Union in the LBC Pedersen Lounge. That's the street level lounge where you first walk in from McAllister. We do those from 10 a.m. to 2 p.m. and it's available to students and employees and staff. And if you're a student that has an aunt that lives uptown and she can't find her flu shot anywhere, she can certainly come and get her flu shot from us, to the whole Tulane community. And generally, I do one last-ditch effort with your students. I will go to where they're lining up to go upstairs to eat at lunchtime the week before Thanksgiving. And I usually say, look, I know your parents don't want you at home for Thanksgiving without a flu shot. Let's get one right now. So there are many opportunities for your student to take advantage of getting their flu shots. We're going to talk just a little bit about confidentiality. Yes, your student's information is private, and we want to keep it that way. But let me explain to you, if you call the Student Health Center and there's been an emergency with your son and we saw them, we're certainly going to get on the phone and talk to you. I don't need your student's permission to listen to your concerns and see what's going on. I will hang the phone up with you after making sure I've got your student's cell phone number correct. I will call them and say, what's going on? Do you need to come in? If we've seen you and you're not getting better, I can always call your student on the phone and put them on speakerphone and have someone else in my building listen. As long as we have two people listening and he says, yes, you can talk about my private health care with my parents. It's just easy to get permission. And it's not something we're trying to keep from you. It's just that we're trying to offer some confidentiality and privacy to your students. The Student Health Center fee is separate from the student health insurance. And let's get that straight. Just about all full-time undergraduate students have been charged the Student Health Center fee per semester to be seen at Student Health. That means he can come in every day if he wants to. We'd rather not see your student every day, but if there's a reason to see him every day, we'll welcome him. So he is already paid to be seen. What we'll do is if he needs labs or he needs a treatment, a nebulizer treatment, they can put those fees on a credit card or we can put them on accounts receivable. We can give you a walkout statement or a receipt and you can file for reimbursement from your insurance company. We do not bill insurance companies. Most undergraduates stay on their parents' plan because that just makes sense, and that's what most students do. But what I want to encourage is that you definitely make sure that your student brings a copy of their insurance card with them. No, they don't need their insurance card to be seen at Student Health, but if they come in and they've got an overwhelming conjunctivitis and we feel they need to see an ophthalmologist today, we have several physicians in the uptown area that when we call, they'll say, tell them to bring something to study, if you can see, and have him wait in our waiting room and we will see him that day. So and I will, and we do that. That's what we do at the Student Health Center. If I think if we think your student has a fracture and we want him to see an orthopedist, there are about 4 or 5 people at different offices we can call and say, do you have a physician in today? Do you have availability? And the next question they're going to ask when they tell me they have availability is, what kind of insurance does the student have? So he will need a copy of that insurance card when we refer them out to get that x-ray and that treatment for that sprained ankle. So please check your out-of-state benefits. That's so very important. There's a lot of information on our website under insurance. It would take me an hour to go through all of it, and I'm not going to do that. So students have to have some type of medical insurance. Most undergraduates stay on their parents' plan, so you need to go online and complete a waiver and document proof that you have adequate coverage for your student while they are in New Orleans. If you choose to buy the Tulane insurance policy that's offered, it covers all immunizations. Some travel immunizations are just a $15 copay. Acne medication and treatment, prescription contraceptive devices, HIV testing, smoking cessation. So it covers quite a few things, and then it covers labs. It's $2,500 a year. You can pay for it per semester, but as I said, compare the cost of that policy with your policy. For instance, if you have, this is your first one going off to college and you have 3 other children at home, and it costs the same whether you have 4 students or 1 student on your plan, certainly you're going to keep him on your plan. If this is your only child and he's going off to college, see what those dependent costs are on your insurance plan and compare your out-of-state benefits to the plan that we offer. So that's the phone number and the extension and the email for our benefits person shown scratchings at the Uptown Student Health Center. Hopefully this has been taken care of already, since they'll be on campus in about a week, but they do need 2 measles, mumps, and rubella vaccines. We do need 1 tetanus, preferably tetanus with diphtheria, and every student needs a meningitis vaccine given within 5 years. There are some of the direct numbers to some of our departments. So just take a minute and write some of that down. And I'm going to answer this first question. If my son has his own family health insurance, can he still access the Tulane Wellness Center? If you're talking about theWell, which is the prevention arm of the Student Health Services, of course, anybody can access theWell. If you're talking about the Student Health Center services, yes. If he's a full-time student, then you've already paid for him to be seen. So yes, he can be seen at the Student Health Center with no physician visit fee. I'm trying to get the rest of these questions.
How can you address how will the waiver of Tulane insurance program affect my son? So I think you addressed that.
Mm-hmm. As long as he has insurance, it doesn't matter the type of insurance as long as the coverage is adequate. I think it's $250,000 coverage. I'm not the insurance expert. If you have questions, please call us and we can refer you down to Shown Scretchens. She's also on our website that you can call her directly.
What is the fee for flu vaccines?
The flu vaccine is $20, and he can put that on accounts receivable, and that's what we usually recommend for them to do.
Any other questions? Can a student get a walkout receipt for the flu shot?
Yes, they can. They just have to remember to ask for it, but we can certainly give them a receipt.
Can a student stop in and take blood pressure?
Yes, absolutely. Absolutely. We do that. If your student has an issue with their blood pressure, we encourage them to come in. They can just come as a walk-in. We usually recommend that they come by in the morning when it's less busy than the afternoons, so in between class or right before lunch. And the best blood pressure is taken after they've been seated for about 5 minutes. So we'll have them sit down and stop and chill for a minute, and then we can take their blood pressure. We do that for many students and staff on campus.
Is there a specific extension for nurse triage?
There is one, and it's on our website.
Does the health center provide NuvaRing birth control?
Yes, we do. We have several options of birth control.
Are there local types of colds or flus or other illnesses that shouldn't surprise us if it happened?
Our flu season is generally right after the winter break. So January, February, March is our worst cold and flu time. But this year it started early. We had some positive flus in November. So it's a little bit unpredictable. And, with people traveling so many different places, and if it's in the tropics, it's flu season all year long. So you're getting on an airplane with someone that just came from the tropics and doesn't even know that they have the flu. So certainly we can evaluate them, just tell them to come in, but I highly recommend a flu vaccine. Every student should have a flu shot.
If a student with private insurance needs labs, will you refer to another lab that is covered by their insurance? For example, Quest.
Yes. We have LabCorp and Quest in the city. LabCorp is the one we generally use because it's on the streetcar line, but it would be good for them to come here first and let us do the paperwork, and that way we can show them where the lab is, give them the hours because they do close for lunch, and give them general directions. It's right next to a Burger King, so it's usually very convenient. But we do that all the time. Yes, some of the labs, especially if a student absolutely wants to know if they have mono. The mono spot test is very inexpensive, but the Epstein-Barr viruses can be costly to the tune of $350. So frequently we do refer out to an outside lab that takes your insurance to get expensive labs done.
My student is under the care of a psychiatrist. If there is a problem with meds, will the on-campus psychiatrist confer with the home doctor on medication management?
This is something that I definitely recommend that you set up ahead of time. It depends on the medication and the diagnosis. Several students, and we take ADD and ADHD medicines seriously here, and we want to make sure that students aren't getting them from us and from their home physician. So yes, we try to communicate, but we need adequate testing results. If your son saw his pediatrician in 2nd grade and his pediatrician said, yes, I think he has ADD and has had no testing since, that is not going to fly with our CAPS services. So I would give them a call if it is, whatever the medicine is, and if he's close to home and can go home some during the school year to see his own provider and get his prescription there, that works too. Whatever is the best fit for your student, his diagnosis, and his medication. But yes, we have full-time psychiatrists in our buildings.
Is the local public safety officer trained in basic first aid or others on campus?
Yes, all of our Tulane police officers take CPR, so they are very well trained.
And whenever there is an emergency, TEMS is called immediately as well. So if medical help is not there right away, we'll be there very shortly. Is there a problem with bug bites based on the damp climate or allergies?
Yes, yes, and yes. Lots of bug bites. I would suggest making sure your student comes with some insect repellent because of a lot of the activities that they do or outdoors on the quad, on the green, and stress to them that they should use that, especially in the evening time. So bug bites can be a problem, and allergies are a problem. I get students that say, oh, I just had seasonal allergies, so I didn't really have to take medicines in the fall. That isn't always the case in New Orleans. I've been at the Student Health Center 17 years, and when I first started working there, the physician that I work with told me that there's actually something in the textbooks called New Orleans asthma, that greater than 300 days of the year out of the 365, there's something blooming in New Orleans because we have so many bouts of warm weather, even through the cold. So yes, we have lots of allergies, and yes, lots of allergy-induced asthma. So if your student is used to taking allergy medicine, send them with a good supply and tell them they may have to take it all year long.
How does the pharmacy charge for meds?
They can pay with a check, with cash, with a credit card, with a debit card, and they can put it on accounts receivable. And we try to work with students. For instance, if they've got some horrific looking skin infection and the antibiotic is going to cost $250, we'll say, look, let's figure out how we can call this in to a pharmacy that can deliver to campus, or how we can get you on the shuttle to go to the pharmacy where they take your insurance. If he comes in and he has strep throat and he's not allergic to penicillin, I believe a 10-day course of penicillin is $12, and he has fever, I'm going to say just get your prescription filled here, please, so that you can start taking your antibiotic right away.
If a student has an anaphylactic allergy and has a reaction, do the EMTs carry epinephrine?
Yes, they do. They are supplied with epinephrine, and so are we.
Any other questions?
I hope we've answered some of your questions tonight, and please understand that I am available. You can get to me through Penny. You can go on to the Student Health Center website, and I'm listed there, and don't hesitate to call or email, and I'll try to answer your questions to the best of my ability.
So thank you, everyone. We will, as I said, post the webinar file to the website, to the parents.tulane.edu website, but it's usually a pretty big file, and it takes us a bit of time to convert it so we can get it uploaded so that you can see it again. So please give us about 5 business days to get that on the website, and you'll be able to find all that information there. If you have feedback about this webinar, we encourage you to email us at parents@tulane.edu, just PARENTS@tulane.edu. And I do encourage you to go back through your emails and look for those parent e-newsletters that we've sent with information about move-in day and suggestions to help you manage the move. We know that you're in that last stretch of getting everything packed and ready for your student to join us. So we hope that you enjoy this last week or so with your student at home, and we look forward to seeing you on Move-In Day Saturday, August 24th. And thank you so much for tuning into the webinar. Good evening.